Hello everyone, I'm Gauravi Mishra and I'm going to present my India Leadership Project, which is based on screening and early detection of NCDs and common cancers among the railway police personnel who are posted in Mumbai. We know that the police in general and also the railway police, they are exposed to risk factors for NCDs and common cancers because of their odd working hours, the stress, their unhealthy lifestyle, and very erratic dietary patterns. You also know here that women in the railway police, they have special issues and challenges that we will be discussing further. Now, after really finalizing the project, we went through all the approvals in terms of ethics committee clearance, establishing a relation with the stakeholders, getting a funding support, recruiting the staff, training the staff, and finally the project was initiated in November 2020. This is the entire methodology of the project, which I will be explaining in the subsequent slides. We are planning to target to cover 4,000 railway police personnel who are posted in Mumbai, both males and females. And this project will be completed in the duration of 12 months. The basic objectives were to assess the risk factor prevalence for NCDs and common cancers, to create awareness among them, to actually look at the prevalence of NCDs and common cancers by screening, to assist them in tobacco control and cessation. But the main aim, the main goal, which was formulated with the help of our mentors, was to actually formulate a demonstrable project, so which is expandable. So what we did in Mumbai, we actually want to do it in such a way that it could be replicated anywhere in the country, and we want to make it a sustainable project by building capacity of the railway police personnel, the railway police health team, so that they could continue the project even when we ended after a period of 1 year. So, in designing the project, the specific criteria for screening and for referral, defining as screen positives for cancers and for NCD screening were formulated, documented, and then funding support was ensured, after which we recruited the staff for the project, we trained them, and then established camps at different railway police stations. Herein, we obtained the list of eligible population, invited them to the camp place, registered them, obtained an informed consent, delivered a comprehensive health education program, and then went about screening for NCDs by collecting blood for glycosylated hemoglobin. The blood pressure measurement was recorded for hypertension. The height, weight, and waist circumference were recorded for documenting obesity. And then we went on screening the people for oral cavity cancers, breast and cervical cancer. Now, in this graph for the risk factor assessment, the blue bar, it represents the India prevalence, the yellow bar represents the prevalence in Maharashtra, and the gray one among the railway police personnel. So we can see here that both the tobacco and alcohol consumption were much higher amongst the railway police males as compared to the general population, whereas it was not the case in female population. And if we are targeting to cover 4,000, we have already covered nearly 1,700 railway police personnel by now. The participation and compliance to health education, to oral cavity screening, and to NCD screening was near 100%. It was slightly less for breast and cervical cancer screening. Till date, we have diagnosed 78 oral precancers and 1 cervical precancer. If we look at the prevalence of diabetes, it was much higher among the railway police male population as compared to the general population. Same was not the case for the female railway police personnel. The prevalence of hypertension amongst both male and female participants was much lower than the general population prevalence. But the prevalence of obesity was higher, and it was especially higher among the male railway police personnel as compared to the general population. Women in the railway police force face some special issues, special challenges, because their duty officially is 12-hour duty, and they stay far off in the suburbs because having an accommodation in the city is quite expensive. So one-way travel comes to nearly 12 hours. Their work demands continuous walking and standing on the railway platforms, and they have irregular timings for breakfast and lunch. They have long duty hours, and the sanitation facilities, the washroom facilities are not really available, and unhygienic use of unhygienic toilets leads to repeated genital infections, and they face a lot of difficulties, especially during the menstrual cycles. On the family front, they are hardly able to spend any time with the family because of extended hours, and many of them actually prefer night shift so that they can take care of their kids during the daytime. Especially with related to health, they are not at all in the habit of getting themselves regularly screened, and they actually fear of getting diagnosed with something because it would disturb their family life. They avoid drinking a lot of water because they would need to then use the washroom very frequently. This project was actually, I could design it because of the different aspects of the coaching received from the Women Lift Health, especially in terms of planning the project to make the project really replicable, expandable, and sustainable. This was entirely with the assistance of mentor and the coaching sessions from the Women Lift Health. Again, negotiation skills that we were taught during this coaching sessions that help prepare the MOU and negotiate during the process. Strategy in terms of networking and ensuring support from the stakeholders, again, which was really emphasized during the coaching sessions, and engaging with the team members in terms of capacity building, also to ensure sustainability of the program. All these were learnings from the coaching sessions, and I really thank the Women Lift Health for guiding me across this journey. Thank you.